I want to ask you this question, and that is, we know what the 20th century was about. We cannot define the 20th century without Marcus Garvey's legacy, without talking about Martin Luther King, without talking about Malcolm X, Shirley Chisholm, Fannie Lou Hamer, without talking about Kwame Nkrumah, Nelson Mandela. These are all the architects of the 20th century as far as the Black world is concerned. What would you like the next century to be known for? And what would you like for it to be remembered about?
Well, the next century is going to be the transformational century. And if it isn't the transformational century, then there won't be any other centuries after it. So it will be the end of time unless we transform. So as you know, global warming is continuing. President Biden is taking it serious. The previous president didn't. So we have to make that change. So in that sense, we need to transform a number of things. Our basic economic structure, in terms of it being, oil-based, in terms of the energy source. We need to go green in terms of sun, in terms of wind, in terms of water energy. We need to conserve our water. We need to stop using all those herbicides and pesticides. We need organic agriculture. Otherwise, we're poisoning our groundwater. And the same thing in terms of all the fertilizers, because most of us have at least 100 chemicals in our body, and nobody knows what the long-term effects of those. So we've gotten a great romance with the chemical industry after World War II, when we took over the German chemical industry. We have to get away from that, get back to nature, and understand that we ourselves have a health system. That's how we were designed. We have a health system, but we must take care of it as a health system. And right now, we in terms of our healthcare system, we don't really have a healthcare system. We have a disease treatment system. So those are things that we must change to be able to promote health and help people to be healthy. But right. we're not doing that. We're treating disease. And you go in there, you have a headache. Okay, I have a pill. You go in there, you have a stomach ache. Okay, take this liquid twice a day, and so on and so forth. That's not getting us anywhere. Like I said, in my office, over 60 people would be on 5 or more medications, and they would not be enjoying their life. So while we have been extending life years, but we're not extending the enjoyment of life. So we need to move in that direction. And that whole business, as I mentioned, that we're one people, we're one race. We have to treat each other with respect and cooperation, and not competition, not individualism, not greed, not wanting more and more and more.
Right.
Seeing that we can manifest our spiritual nature in a physical sense, in terms of how we cooperate with each other and the systems that we create.